Hi, my name is Dr. Jared Thornton with Thornton Family Chiropractic. I want to take a quick minute today and talk to you a little bit about our NovoPulse system. Um, we get a lot of questions about it and wanted to take just a minute today and talk to you briefly about what it is, how it works, and answer some of the questions that we get. So first question that we get that everybody wants to know is will this work for me? And to give you a complete answer to that is I really don't know. Chances are very likely that it will, especially if your condition is osteoarthritis based. This equipment was designed specifically to treat osteoarthritis. So if you have osteoarthritis, chances are it's going to work for you. The best way for us to know is to get you in for an examination where we go through orthopedic tests, we go through your past medical history, we'll review any x-rays or CT scans or MRIs that you've had done to verify that this will indeed uh, be likely to benefit you. Okay. Second question we get is how does it work? Well, it's somewhat complicated because it's actually working on a cellular level. But in a nutshell, what happens is this device actually stimulates the cells deep in the body to start healing. And it has been absolutely amazing and phenomenal to watch the results that we get. The third question that we get is just that. What are the results? What kind of results do you get? And the answer is we have been getting phenomenal results. Tell you a real quick story about me, and then if you want to hear more stories, we're going to be posting more videos later on with more stories of other patients that this device has helped. Okay, my story is when I was a teenager, I had a knee condition that developed, and I've had a bad knee ever since then. About 9 years ago, I went to the doctor because I'd injured my knee, and he asked me if I'd had any major significant knee injury. And I asked him why, and he says, well, your knee looks like an 80-year-old, and at age 35, you are ready for a full knee replacement. And we can't do it right now because you're too young. He said, he went on to say that I needed to wait until I was at least 50 to get my knee replaced and to try and do everything I could to preserve my knee function and the cartilage that was left in my knee, and told me good luck, we'll see you in a few more years. Well, I've done everything I could. I've tried every supplement, I've done all this stuff to try and help with my knee, and quite frankly, up until I started doing NovoPulse to walk 1 to 2 miles, I would start limping. It just has never been good ever since I had that knee injury about 9 years ago. Well, after 6 weeks of NovoPulse treatment, I was able to start playing basketball again. I can run again. It is amazing to me how well my knee feels. Well, back in a couple months ago, as some of you are aware, I actually broke my left leg playing basketball, which I would have never done had NovoPulse not worked for my right knee. It's kind of strange how that works. But when we did x-rays, we did to see how my left knee was healing, they did a comparison study, and they actually looked at the images on my right leg to see how it looked compared to my left. And the amazing thing is there was no signs of arthritis in my right knee. I am stunned that it worked that well, quite honestly. And it has been amazing. My right knee feels great. My left leg is healing well. We've actually used NovoPulse to help treat it, and we're a little bit ahead of schedule, which I'm really excited about. So that's one of many stories on how well it works. The last question we get is does insurance cover it? And the answer to that is unfortunately no. We keep the cost very minimal, and we can go over all that with you. But for the money that you spend on this and the results you get are astounding. In fact, a study was done to track what the results were for this therapy. And patients who did the therapy 3 times a week for 6 weeks, after therapy, a year after treatment, they actually went back and followed up with them to see how they were doing. And 78% said that they still had a reduction in pain. 79% said that they still had an increase in function. Then they went out 2 years, and it was right around 60% of the respondents, of the individuals who did therapy, actually said they still had a decrease in pain and an increase in function. I have not seen any type of therapy where you can do therapy for a non-invasive therapy for 6 weeks and turn around and have these type of results that are lasting for 2 years. Is it a cure-all, fix-all? No, it is not. However, the results we're getting are phenomenal. We're seeing these type of results in our own clinic. We're super excited about it. Again, give us a call. Let's get you in, and let's make sure that this is something that's going to be beneficial for you. My name is Dr. Jared Thornton with Thornton Family Chiropractic. We hope to see you soon. Thanks.